age 15, adult prevalence stands at 1.49%, with 15,219 new infections and 12,614 AIDS-related deaths recorded last year. Encouragingly, viral suppression among those on treatment has reached 90%. Prevention of mother-to-child transmission stands at 99.3%, nearly universal. Yet, treatment coverage remains inadequate. Only 47.5% of adults and 35.8% of children living with HIV are receiving therapy. This treatment gap remains the single largest threat to achieving epidemic control. The epidemic is unevenly distributed across the country. Greater Accra and Ashanti regions account for nearly 40% of all new infections. Adolescents and young adults aged 10 to 24 years contribute almost 1/3 of new cases, with adolescent girls and young women disproportionately affected due to entrenched gender inequalities and socioeconomic vulnerabilities. Key populations including female sex workers, men who have sex with men, people who inject drugs, transgender persons continue to face reduced access to services due to stigma and discrimination. Tackling these inequalities is an essential requirement for achieving epidemic control. Ghana's progress towards the UN AIDS 95 is as follows. 68% of people living with HIV know their status. 69% of those diagnosed are on treatment, and 90% of those on treatment are virally suppressed. The most urgent gap is treatment enrollment. More than 160,000 people living with or diagnosed with HIV remains untreated. Closing this gap is critical if Ghana is to achieve the 2030 goal of ending AIDS as a public health threat. Ladies and gentlemen, historically, Ghana's HIV response has been financed through a combination of domestic resources and support from development partners. However, recent development poses a significant threat to this balance. The withdrawal of USAID support for the procurement and distribution of antiretroviral medicines has the potential to create serious vulnerabilities in our supply chain, particularly in districts that rely heavily on USAID for consistent ARV availability. This withdrawal risks creating delivery gaps, stockouts, and increased pressure on our domestic health budget. As these vulnerabilities materialize, they would jeopardize continuity of care, threaten viral suppression gains, and increase the risk of drug resistance. These vulnerabilities were averted because President Mahama took bold, swift, and decisive decision, directing the Minister for Finance to immediately allocate domestic resources to cover the emerging funding gaps. This intervention ensured uninterrupted ARV supply nationwide and protected the integrity of Ghana's treatment program. Building on this decisive response, Ghana is now advancing through critical reforms, operationalizing the National HIV and AIDS Fund to provide dedicated practical domestic financing for treatment, prevention, and community procurement. Integrating essential HIV services and progressively selected HIV commodities into the National Health Insurance Scheme to guarantee sustainable, locally anchored funding for the HIV response. We are also accelerating the local manufacturing agenda for HIV commodities, including ARVs, condoms, and diagnosis, with targeted investment, regulatory strengthening, and structured market commitment. Ghana seeks to reduce its dependence on the external supply chain and position itself as a regional hub for high-quality HIV commodities. This is central to Africa's broader health sovereignty agenda. Ghana's challenges are shared across the continent: declining donor support, fragile supply chains, and persistent health system constraints strengthen collective progress. The African Health Sovereignty Summit, held in Accra earlier this year, reaffirmed that Africa must lead in defining, financing, implementing its own health priorities. Health sovereignty calls for robust systems, locally grounded policies, and unwavering commitment to the rights and dignity of all people living with HIV. The theme of ICASA 2025, Integration, Innovation, and Inclusion, aligns strongly with Ghana's vision for a resilient health system. Integration requires embedding HIV prevention, testing, and treatment within primary health care, reproductive health, and universal health coverage systems. Innovation demands African-led solutions, digital transformation, and differentiated services delivery models. Inclusion requires that no one is left behind, especially women, adolescents, and key populations who remain at heightened risk. Through the Ghana Medical Trust Fund, popularly known as Mahama Cares, we are strengthening sustainable financing and the integrated delivery of chronic care services. Separately, the free primary health care program, which is distinct from Mahama Care, is expanding universal access to prevention, early detection, essential care by removing financial barriers living with HIV. Advancing living with HIV. Advancing African leadership in defining and delivering our health agenda. Let this conference be a moment where evidence guides our decisions, voices shape our strategies, and our shared vision of health, empowering Africa inspires our collective action. Together, we can build a continent where HIV and STIs are no longer threatening lives, aspirations, or development. Africa where health sovereignty is realized and the promise of dignity and well-being is secured for all. We wish you a productive, inspiring, and impactful conference. Grateful for the opportunity.
Honorable Kabuna Mita Akando. We are speaking at ICASA 2025. We now want to hear a message from the WHO Regional Office for Africa. And this message will be delivered by video link. Let's receive Dr. Mohammed Janabi, who brings us some remarks for ICASA 2025.
Your Excellency, President John Dramani Mahama, President of the Republic of Ghana, Honorable Ministers, Dr. David Pereira Nyatwa, ICASA 2025 Presidents, civil society leaders, distinguished guests, ladies and gentlemen. I wish I could be there with you in Accra today. The timing of other commitments makes that impossible, but I'm grateful for the chance to share this message as we open ICASA 2025. My warm thanks go to the government and people of Ghana. You have welcomed this conference with your characteristics, generosity, and leadership. Accra, to me, has always been a place where Africa's public health ambitions gain strength. This year, that spirit feels even more important. Global health financing is tightening, donor priorities are changing, HIV, TB, and malaria programs are feeling the strain. These shifts are difficult, but they also push us towards something essential. Responses that are African-led, sustainable, and built to last.